In Toledo, we have the highest number of dengue cases. It is, of course, unusual. We have never seen that before, Toledo having such a high number of cases. What we can say at this point in time is that the cases are scattered from both rural and within urban here in town. And it is attributed to many different things. I can say presently that I'm urging the public once again to take this situation very seriously. We have to acknowledge how severe dengue really is. It is important because we see from the trends that dengue is spreading within families and from families to neighbors, and then those neighbors eventually have a spread within their family, which is telling us that the patients that we meet on a daily basis that we are trying to assist are not really taking heed in order to prevent these cases from spreading. So I would want to urge the public, to take dengue very, very seriously, and to, of course, take the advices from the Ministry of Health and Wellness, which is, of course, through the Vector Control Department. You will see that our interventions are ongoing. We have staff on the ground doing prompt case investigation, premises inspection, larviciding, and of course we're doing a lot of adulticiding, which is the ULV operation with the fogger behind the vehicle. That is not sustainable. We have to be careful on how we do these interventions, but we do it as it is required. Let me tell you that this has been throughout the month of June. We have not stopped with these operations. We are trying to curb this situation as best as we can, but it can only be done with the participation and collaboration of the public. We are urging anybody, if you're having dengue symptoms, which are headache, fever, deep eye pain, rash on the skin, difficulty breathing, nausea, please come into the hospital and see a doctor. That is only when we at the ministry becomes aware that there is a situation and we can address it. Every patient tolerates dengue differently. Some patients have a very good immune system and they do very good, and they tend to stay at home and they do indeed recover. But what this causes is the spread of dengue. That during their time that they are infectious, during the time that they are ill, mosquitoes are biting them, and that is when this deadly disease is spreading. Now, if the patients come to the hospital and we are aware and cognizant that they are ill, we will do the necessary interventions and precautions around those specific families to ensure that the disease doesn't spread from one family to another. And this is what I keep urging the public to do.